Hi guys, my name is Chaya Chauhan and I own True Smile Dental Practice. At the moment, all dental practices have been asked to shut down due to preventing the spread of COVID-19. So I've decided to try and do some videos to help my patients with any common problems that they may have. So this is a series of videos, so you may want to flick past to the one that's relevant for you. So this particular video I'm going to be doing about ulcers. Basically, I used to get ulcers and they are so painful. They are, it's a bit like having a paper cut, except it's in your mouth and you can't avoid it. And it's like a searing, sharp pain, like an electric shock type pain, if anything goes on your ulcer. Nice thing to know is most ulcers are self-limiting. Some people generally suffer with ulcers. Causes of ulcers can be things like trauma, so if you sort of dug your toothbrush too hard in an area, or a knife and fork. You can have further medical problems like iron deficiency or B12 deficiency, and there's certain chemicals that trigger sort of ulcers as well, like spicy foods or tomatoes. It can be stress or anxiety related, or it can even be sort of a genetic problem that runs in your family. So there's lots of different things that actually cause ulcers. So this is, I'm just going to be talking to you about sort of the regular ulcers that people get from time to time that can be really painful. Usually they clear up within 2 weeks or so. You can also get ulcers if you've got a broken tooth and it's or a really sharp filling, or a denture rubbing on an area, or maybe you're having braces and a wire or a bracket on the area. So if it's anything like that, then the first thing is, if you know what the cause is, just try and remove it. So for example, if it's your dentures rubbing, then try not to wear your dentures, or try and put some C-bond or some sort of cushion between the dentures and your actual gums to help prevent the dentures rubbing and causing trauma. If it's a sharp filling, then what you can do is, here's an idea. My son was having some little baby bell things earlier, and I noticed they come with this really great little pink wax stuff. So what you can do, if you can't get to your dentist, and if you have ortho treatment, orthodontic braces, then your dentist may well have given you wax anyway. Say if you've run out and you can't get to your dentist, you can get some of this baby bell covering thing, or you get some on Edam cheese as well. You can rub it in, you can roll it into a little ball, and then you can literally mold it onto your tooth, onto the sharp bit, and you can kind of leave it there. And it's quite sticky, it kind of adheres to the tooth for a little while. It's not great, it's not going to last forever, but guys, I'm just giving you little hacks and tricks that you can do before, once you can't access your dentist. Obviously, as soon as you get the practices are open again, go to see your dentist, and then we can smooth the area down or refill it or do whatever is relevant. So number one, remove the cause. If you can see one and you know there is one, and try it, and that in itself will allow the ulcer to stop being aggravated and to start healing. Try and have a soft diet, so don't have hard foods like nuts and things like that, because that's going to be so painful. Soft things like jelly, ice cream, yogurts, bananas, anything like that that doesn't really sit on the ulcer and help to and hurt it. Salty water mouth rinses, so half a teaspoon of salt and a mug full of warm water, and just gargle it around your mouth. Now I know I've done this myself, and when it goes on ulcer it really stings and you think, why am I doing this? But once you do it a couple of times, and do it like 5 gargles, it starts to almost numb the ulcer, and it helps it to heal as well. You can also buy some Difflam mouthwash. So this is a mouthwash that you might be able to get at your local pharmacy, or you may need a prescription for it, in which case you can contact your dentist or perhaps your doctor, who might be able to give you a prescription for it. Another thing that you can use is Corsador mouthwash, and this prevents heavy sort of bacterial infections over the top of the ulcer. So use your Corsador mouthwash, gargle it for 2 minutes, spit out, and do it last thing at night, and then don't have anything to eat or drink, and just sort of leave it there to work its magic overnight. Don't use Corsador mouthwash for over a week or 10 days, because then it can start having negative effects. And the other thing is to have really excellent oral hygiene. So make sure you brush your teeth, make sure you carry on flossing them, and make sure that it's sort of really you're really sort of helping for that to create a clean environment in your mouth for the ulcer to heal up. There are lots of little gels and things, so Blongella and oral gel, things like that can really help. And other than that, just sort of wait it out basically. It lasts for about 10 days or so. Usually after the first sort of like 4 or 5 days, the really painful time is over, and then it will start sort of healing, getting better and better. So sometimes waiting it out is the only way to go. Now, if you have an ulcer and it's been there for more than 3 weeks and it doesn't have any obvious traumatic cause, or you've tried all of those things and nothing is helping it, it's just getting worse and worse, then you must contact your dentist or ring 111 straight away. This is a serious matter and you need to be referred to the correct people to take a look at that ulcer. So if you've got a non-healing ulcer that's lasted for 3 weeks or longer, then do get in touch, because that's a really important one. Okay guys, thank you very much, and that's my video done about ulcers. So we're at True Smile Dental Practice. If you have any dental emergencies or dental problems, then I'm on the end of the phone at True Smile Dental Practice. My phone number here is 01268 544 218. Thank you.